What is back pain? Back pain is a common health issue in adults all over the world. Our back is supported by a spinal column made up of 33 bones that are cushioned with cartilage, ligaments, muscles, and tendons. Long sitting hours at work, sprains due to strenuous exercise, incorrect sitting posture, and sudden bends can injure these supporting structures, resulting in bruising of bones and back pain. What causes back pain? There can be several causes of back pain. Injury, slipped disc, and fracture in bones are the most common injuries, resulting in back pain. Sometimes a muscle pull or overbending can also result in muscle injury and thus causes back pain. Overstraining of back muscles. Overstraining of back muscles can be due to strenuous exercise. Long sitting hours can also put a strain on back, causing back pain. Improper sitting positions, uncomfortable chairs, and awkward body movements can strain cartilages and muscles, resulting in discomfort. Bone degenerative conditions. Certain bone degenerative diseases, like osteoporosis, affect the spine and can be an underlying cause for chronic back pain. These diseases make bones weak and vulnerable and cause further damage. Home remedies for back pain. Core strengthening exercises. Exercising to the core is one of the best pain-relieving techniques, and bones are helpful to manage pain caused due to sprains and sudden jerks. Regular exercises and yoga reduce the risk of getting muscle spasms and injuries. If facing a problem of acute back pain, visiting a therapist for physical therapy and treatment can improve the condition. Sleep properly. Proper rest and sleep are necessary to prevent back pain. One must take rest and lie properly on a hard mattress that allows your back to remain straight. A soft cushioning mattress could worsen the condition as they do not maintain a straight posture. Boost calcium intake. Osteoporosis and arthritis are some of the worst degenerating diseases. They make bones and muscles weak and accident-prone. Osteoporosis is caused due to low bone density. Boosting calcium and vitamin D intake in your diet helps improve these conditions, lowering the symptoms. Include calcium-rich foods such as dairy products, lean meat, fatty fish, green, leafy veggies, and fruits to improve calcium levels in the body. Always remember that calcium, vitamin D, and other nutrients are best obtained through your diet. So as far as possible, reduce your dependency on tablets. Healthy diet. A diet loaded with essential nutrients replenishes deficient minerals that in turn help reduce back pain. Adhere to a diet rich in proteins, omega-3, fatty acids, phosphorus, and fibers. These nutrients prevent progression of pain and help in conditions such as arthritis and osteoporosis. Food supplements to fulfill deficient nutrients in the body can also be taken. Bromelain, which is derived from pineapple, is another helpful enzyme in reducing swelling and pain.